Well, to discuss that further, joining me now is Dr Bharat Pankhania. He's Senior Clinical Lecturer at Exeter University, also an expert in communicable disease and public health, a familiar face on Sky News as well. Good to see you this afternoon. What do you think then? Further restrictions, are they necessary, and if so, when?
So I was listening to Sajid Javid say all those things, and, by and large, I agree with him and his analysis. The bit that Sajid Javid finds it difficult to mention is that infection control is a multifaceted operation. The multifaceted operation is wear a mask, wear it properly, avoid crowds, avoid gatherings, as well as take your vaccines, as well as take your boosters. So the other bits that he emphasizes a lot about is boosters. I tell you, Sajid Javid and anyone who is listening, people who have been fully immunized as well as boosted do get infected. Therefore, we really must also have infection control measures. Now, in answering your question about should we have restrictions, well, I'm looking at the date now. It's the 19th of December today. And if we wish to suppress cases, the rising tide of cases, the time is now. But then again, the machinery of government moves very slowly. I would advise people, make your own decisions and keep yourselves safe, just like what the CMO was suggesting.
Some modelling suggests that if we stick with Plan B as we are, we could see more than 3,000 hospitalisations a day. I mean, that's still better than last winter's peak, isn't it? And of course, we're in a better place now, what with the booster programme.
Indeed, and therefore I am reasonably comfortable that we may not need the so-called circuit breaker and restrictions. But on a personal level, I feel everyone ought to take caution and make sure that they are not infectious before they gather. So we are in a better place compared to Netherlands, where they started their booster programs a lot later than ourselves. Having said that, boosters doesn't mean you've got an invisible shield around you. You've got to take additional measures as well as taking your boosters.
What about this BMA warning? It's rather worrying, isn't it? 50,000 NHS staff could be off sick with COVID before Christmas Day.
And it is worrisome. And over there, again, people like myself have been working on these BMA committees, advising that really better quality PPE be made available. And since Delta arrived, and Delta is more infectious than the Alpha versions, and Omicron is much more infectious than Delta, we should really promote the use of FFP2 masks, which are much higher specification and afford better protection to healthcare workers in their critical posts there.
We are learning more, of course, about Omicron, aren't we? Some suggestion that it affects the upper respiratory tract, the throat rather than the lungs, which would be a good sign, wouldn't it? And also that it is much weaker. It's so hard to know at this stage, isn't it? But obviously the government are gambling on the fact that perhaps it is going to be weaker. What are your thoughts? What's your assessment on the little that we know so far?
So yes, I'm aware of the report that you just mentioned, which is that the Omicron likes to settle down in the bronchus, in other words, the bigger airways, rather than into the far reaches of the lung tissue. That, to me, is a good sign, because when you've got an infection in your lung tissues, that's where you get your viral pneumonia, severe illness, and may need a ventilator. So those are positive things that we know about Omicron. The trouble is, and Sajid Javid said so, which is a small percentage of a very large number is still a very large number of people who may need hospitalization. And that is the bit that we hope doesn't happen. With respect to illness and things, in a couple of weeks' time, when all those cases that have been generated will give us a very good indicator of, is it causing severe disease or is it okay and we can sail through? We will know in a couple of weeks' time.
Everything you've been saying so far seems sort of eminently sensible and actually pretty optimistic, if I may say so. But you're talking about people taking precautions, being sensible. What is your advice? And talk in specifics, if you can, about Christmas and about New Year in terms of seeing friends and family.
My pleasure, really. And I really want everyone to have a good Christmas because it has been a hard year. So I would say, look, take your precautions now. It's the 19th of December. If you are meeting up very soon, leading up to the 25th, now is the time to reduce your interactions with other groups. Postpone your office party, postpone your getting together with other friends, and reduce that circulation, because I don't want you to be incubating the illness and then when you're with family you become a case. And then finally, before you all get together, do one more thing. Ask yourself, am I okay? Am I well? Have I got any new signs and symptoms? And finally, do a lateral flow test to ascertain that you are truly not a case, and then happily meet. I think it's as simple as that. And of course, when you are busy doing your Christmas shopping and things, I just found something here. So when you're busy doing your Christmas shopping and things, wear a mask. Wear a good quality mask like these. These are FFP2 masks, much better protection than the flimsy things that we've so far been wearing.
Yeah, really good advice. Really echoing what Chris Whitty has been saying. Yes. What is very worrying is the situation in London. And we're also hearing that 1 in 3 people in the capital are unvaccinated. I mean, that's incredible, isn't it?
It's very worrying and sort of really disappointing. And I, as a public health doctor, feel disappointed because I feel it is our failing, our public health messaging. You know, in the days when we were well funded and we had many public health people, we did a lot of advise, inform, educate, listen to them, allay their fears and take them with us. I was really shocked to learn yesterday that many Premier League footballers are not immunized. These are elite athletes. One way to remain an elite is not to get infected, not to damage your lungs. So I would say to all people, don't damage yourselves, protect yourselves. These vaccines are really safe. They will stop you from dying. So please make that step forward and take your vaccines and take your boosters and take your seasonal influenza vaccine as well.
OK, good to speak to you and get your thoughts as always. Have a happy Christmas. Dr. Bharat Pankhania, thank you.
Thank you.